testing effort.
All right, so we are going to start right off with a Menti. So if you could go ahead and open another window and then pop in that code, you should see it in the chat. And I'm going to go ahead and go to the Menti screen so that way you can see what other people are thinking on this question. Okay. Sorry, let me go back. All right, so what do you want to learn today? What do you want to get out of our time together? So this session is for all of us. So you can go ahead and type in the chat, just a quick blurb, as many as you want, actually, to kind of let us know and let the group know what you're hoping to get out of our time together. Okay, how can we use our data to better serve Sac County residents? I would love to see numbers on what areas we're still seeing gaps on those getting tested, best and promising practices and accountability to taxpayers. Would like to learn about what worked well between Sac County and community partners. An understanding of how effective the county and CBO's relationship during the pandemic was. Purpose of this group and time commitment. How we can support communities better outside of COVID. And then in the chat, I'm seeing looking forward to a cumulative knowledge of qualitative info and strengths that have been passed on. Awesome. And maybe to just respond to the purpose of this group. So the purpose of this session is to reflect and learn about the COVID-19 community testing partnership that happened during the COVID response. And so there's no ongoing time commitment for this group, but we can talk about what the time commitment was for being a part of the testing partnership. We also know that many sites are continuing to do COVID testing. So we're talking about the period of COVID testing where we had a full programmatic piece in play in partnership with the Sierra Health Foundation and the county. How we can support communities better outside of COVID. Great. Okay, any last thoughts on here? Lessons learned from the partnership for future planning. Okay, we'll just give it one more second. And then that can help inform how Bobby and I spend our time. Alrighty, thank y'all. Okay, so let's go back here. All right, so our agenda today is we're going to talk about the background of the community testing partnership, lift up some key components that community testing sites articulated as important for this type of partnership. We'll talk about what worked, glows, what can be improved, grows, and then circle in on some key considerations that folks might look at for a partnership similar to this moving forward. All right, so some basic background is that the partnership had 13 community testing sites, completed over 300,000 tests in the program, and was for 2 years. And again, the testing sites, many testing sites are continuing, so we're just taking a snapshot of the program when it was at its full partnership. All right, so the essence of the testing program was the testing teams in the 13 community testing sites. So we wanted to lift up some of those people. There are many more that aren't on this slide, but we want to center the individuals and programs that ran these sites for so long. We also want to lift up how many other partners there were that allowed the testing program to be possible. So I won't read off all these, but there was a number of labs we partnered with, a number of additional services such as biohazard waste, some community organizations such as Resources for Independent Living that helped us think through our disability access, and a number of county organizations such as the Disability Advisory Commission and Elections Office that helped us make these sites as great as possible. All right, so we have our next Menti here that'll kind of frame this next part of the presentation. So if you could go ahead and head there.
Thanks, Liz. And so if everybody can just log into Menti, should see that the next question is going to be, what part of Sacramento County do you identify with? So this might be, where you are living or where you work, or maybe just an area of Sacramento County that you frequent a lot or people in. So go ahead and just pin a location on the Menti, and then we'll kind of take a look about where we're all most identified with. Okay, so looks like, we have a pretty strong distribution of us in the county, particularly north of, what is that? I guess that's around north of the Delta and whatnot, but then a couple folks, down in the southern part of the county, and then in kind of like a lot of folks in the north part of the county as well, kind of going across the very top. All right, and thank you, Ben. You assist throughout the county, and that may be throughout the entire county, and that could very well be the case for all of you, right? Because of the nature of your work and everything. So we'll also keep that in mind, but that's also how we continue to do our piece. So let's go ahead and go to the next question. So being that you identify with that part of the county or maybe the entire county, how did you or your community access COVID testing over the last 2 years? All right, so my primary care doctor and at-home tests, great. Free test sites, the Natomas community testing site, through my medical provider, home tests, via Google, nonprofit COVID sites, medical provider again, community resource centers, Rite Aid, the Cal Expo testing site, found a free COVID test through My Turn, awesome. At local community testing sites, mostly in South Sac, Rite Aid, free testing sites, and primary care doctor. Now with the state program, through our testing site medical providers, primary care doctor, sometimes Google search to see where the free test sites were. Great. So, I mean, it sounds like, and like, I want to acknowledge, right, like our group here, there may be some selection bias, right? Like for those of us that have primary care providers, it may be easier to find, or, that's a possibility. I know there are actually a lot of pediatric offices that don't don't offer testing, and so and there's a need for that to happen. So it can sort of be challenging, but lots of folks that did home tests, which are much more available than they were at the beginning of the pandemic, going to the free testing sites and using their primary care providers. So thank you for that.
Yeah, and we know that the mentee might not be accessible by everybody, so appreciate folks putting their responses in the chat. And if the chat is also not accessible to you, if you're calling in, then feel free to unmute and we'll try to leave some space at the end of any questions for you to voice your feedback.
Great. Thanks, Liz. Yeah, would anyone else like to maybe share how you access testing? If you want to unmute or if you want to put in the chat. Okay. Hearing none, let's go ahead and go to the next slide, Liz. So we got to see where we were all located. And if we think about that area that we pinned, if you're familiar with the Healthy Places Index, right? This is the HPI is something that's used throughout the state and it divides up areas into quartiles. So the bottom 25% that are the most vulnerable, and unfortunately, we know that health outcomes are sort of dictated by our zip code, then all the way up to the top 25%. So on this map, you can see the darker blue is the bottom 25%, the bottom quartile in the HPI within Sacramento County. And the green areas, the darker green is the highest 25% in the Sacramento area. We, like many organizations, Sacramento County, as well as a lot of our organizations that serve the community, we look at this and we look at this data in order to make good decisions and data-driven decisions on where to, in this case, locate our testing sites. So when you look at this, and let's go to the next slide, we can see we did an assessment of where testing was available in our county, and we mapped them on this Google map. So I'm going to ask Liz to just show currently where the testing was offered, taking off the network providers as well as the free testing. So it was basically the pay to test we'll leave on, and then we'll actually also leave the network members as well. So this is where, and I want to acknowledge that this is a snapshot sort of later as testing was more developed in our county. And so you can see, and again, in this case, on this map, you'll see that the green areas are the highest quartile, and then the pink, red, and orange are the lowest quartiles. So from that Healthy Places Index. So you can see that there's a pretty strong distribution on the sort of west side of the county, but then over on the east side of the county and also in the south and into the Delta, there was not a lot of testing at all. The test sites that we're showing right now are where folks would either have to pay out of pocket for tests, or they had to be a network member. So they were part of the Kaiser network or some other network that they're probably paying for that service on a monthly subscription basis or something, or maybe it's through their employer, right? So this leaves out folks that maybe don't have healthcare, or maybe they're underemployed or unemployed at the moment. And so this is where our free testing sites went on. So Liz, can I have you add on the county test, the 13 county test sites? So when we add that on, you can see that we extended a little bit eastward, right? Again, into these orange and pink areas that were still lower quartile areas. So you can see these are the blue pins. And then also into the south part of the county, because there were 0 testing options in the southern part of the county. So particularly in the River Delta, as well as in Galt, we made sure that there were community testing sites there and approached groups and organizations there that could potentially host testing sites. And then Liz, if we want to add on now all the free options that are available today. So as Other nonprofits heard about being able to sign up with the state and offer free testing themselves. And in a lot of cases, we helped support them to get signed up with the state lab. You can see that the concentration spreads out a little bit, but it still doesn't go as far south or as far east as where our sites were at. So, all that meaning to say that, our sites were really filling a gap where there was a vast need for that. Any questions about, this map and how we located these, or where we located our community test sites? Thanks, Darlene. We owe it to another a lead, David Kempa, that really helped us create this for us. Okay, not seeing any other questions. Let's go ahead and move on to the next slide, Liz. Thank you. So this was, and you'll see that this chart will mimic, the great dashboard that Sacramento County provides. This is for our community testing sites. This is not positivity or positive cases. This is actually volume of testing that was done. You can see that at the beginning or middle of 2020, we were in the low 5,000s, 4,000s, and then as we reached certain milestones, like the fall of 2020, we almost reached the 20,000 mark. Then in the summer of 2021, we got past the 40,000 mark. And then the winter of 2021, we almost got to 60,000. And these are monthly numbers. So that 60,000 is within a month. And so that's how we, there was, while there were ups and downs, the trend line is that there were more and more people testing. And again, in the beginning, we started with fewer sites. Initially, there was 2 sites, and we added more until we grew to the 13 sites, which, some of them even continue on today as they partnered with the state. Any questions about this chart and these numbers? Anne-Marie, thank you for your question. Do you think we will ever get past the pandemic? Also, has monkeypox reached Sac County? I mean, I can certainly share my opinion that, like, the experts that I'm following and listening to say that, like, we will reach an endemic phase in with COVID-19, and that endemic phase will be, we'll be dealing with it. But we do continue to get better and better. I don't know that, depending on how you define getting fully past it, then I would say that we will never fully get past it because of the endemic phase. It'll always be something that we learn to live with. And I will defer on the monkeypox question because I'm not as familiar with that and how much it's infiltrated Sacramento County.
Yeah, maybe we'll hold the monkeypox question since we are not discussing that today, but I see that Mike put a resource in there for you, Anne-Marie,
Okay.
which is great.
Yeah, thank you, Mike. And so will it be like getting an annual flu shot? From what I hear and understand, it'll be somewhat like that. I don't know that it'll be annual, but that, there will be steady case increases during certain parts of the year. And that's kind of like what we're seeing and what we'll probably continue to see. So thank you for your questions. Thank you, Mike, for sharing that monkeypox resource. And then let's go to the next slide. So this chart was, overall, but we wanted to cover some of the milestones and key dates that took place over this time period. On March 19th was when the Sacramento County Board ratified that COVID-19 was a public health emergency and that we were in an emergency. Shortly after that, the county authorized to receive and to apply for and receive funds to fund a response. Almost immediately, the county partnered with UC Davis and they opened up 2 community testing sites, initially starting with them. The following month, 3 new sites came on board, and unfortunately in June of 2020, There was an excess of 10% in hospitalizations for 3 consecutive days. And then by the July 13th, Governor Newsom announced that all indoor operations would close in certain sectors. So that was, the strongest extent of our of our quote unquote lockdown. Going into August, there were 5 additional sites that joined up, and the testing items were being seen by the Board of Supervisors at that point. Around that time, however, and I recall this, I remember this very vividly, there was a PPE shortage. Swabs were in short supply, testing materials were in short supply. And so UC Davis, who was our partner at that point, needed to focus on reserving or maintaining their delivery of services to their patients at the UC Davis Medical Center. And so they stopped being our partner, and the county found STEM Express, a local company, to begin partnering with to provide community testing. So there was about a 1 to 2 week gap there where actually the National Guard stepped in, and they actually provided testing at some of those sites during that gap. And then STEM Express took over. The county stopped doing the testing at Cal Expo. I believe that the state took over that site after that. And so that was important. That's about January of 2021. By February, that's when we reached our full capacity of the 13 community test sites. And then in June 15, and you'll recall that that second peak that we experienced in the summer of 2021 was partially driven by the first mask mandate being lifted by the state. And not having, at that point, they were not vaccinating all age groups yet, like they are now. So that first mask mandate, removing the first mask mandate, drove some of those numbers. And then in the next slide, if we go further into 2021.
Bobby, just a quick note on the January. So this was the transition from another lab. So we transitioned from the Express lab over to the free state of California lab, which we'll talk a little bit about.
Yes,
further.
thank you for that. I'll note on that transition from the STEM Express lab to the state lab, that was when we were moving from full service testing to a self-swab model. So there was training that had to happen on the community sites end on how to swab supervise and support in that way. And so there was quite a bit of shifting over that time. By August of 2021, we hit our first peak of almost 10,000 tests. January of 2022, that second peak of 15,000 tests. And these were in weeks. So these are weekly numbers. So we hit almost 10,000 in 1 week in August, and then over 15,000 in 1 week in January. In February, some of the sites started to exit the program. They had been going for a year and a half at that point. And then in March, there was a transition for the sites that were going to continue. They applied for the state testing grant, and they were able to get grant funding from the state in order to continue operations. And even until now, some sites continue to ramp down, and other sites continue to keep going to provide testing. And as you all probably know, our case numbers are, going up currently, and they are not there are more cases now than there were earlier in the year. Any questions about the timeline that I just went over, or queries or thoughts?
I had forgotten how much fun we were having back then.
Yes.
As you're going through all this stuff, I remember changing test providers, going through the training, and yeah, it's just funny looking back as you put it on paper.
Yes, absolutely. When you're in the middle of it, right, like there's not really time to reflect, but part of this process and being able to reflect is incredibly valuable. Alma, I see you have your hand raised.
Yeah, I mean, I'm part just gonna second, the last comment. In a way, we haven't forgotten because it's unfortunately still kind of like a little bit of that, right? Even with other things, as we continue to think of the pandemic as like it's gonna be over soon, but like we're still not really seeing that concretely. And so one of the things that I wanted to ask was if there were any specific processes that the county got basically documented in the sense of how you work with partners and the communication channels, from seeing all these, stuff that we went through together, working with community-based organizations. Was there anything concretely that like you all can like point to and say like, well, now this is one of the things that the county start implementing as like a real life, application that you know of?
That's a great question, and that's actually the purpose of this learning session. Our goal is to, at the end of the presentation, we have some key indicators and factors that we hope that the county will continue to consider as it moves through serving the community and working with the community. So that's definitely where we're heading. Thank you, Alma. So next, another piece of feedback that we wanted to get, if we can go to the next slide, we held a debrief with the community test sites at the end of when they were transitioning from the county to the state, and we asked there's 15 responses here because some of the sites were double represented, but overwhelmingly they felt that the pace of the downsizing of the program was just right. One did feel that it was too fast, and two felt it was too slow. But like, as far as like how it goes, the responsiveness of the program, it was really the whole way. It was a lot of communication on, when should we go down, when should we not, quite frankly, that last spring when there was a peak rising, I think it was because of the Omicron variant, subvariant, the first one. The sites that wanted to close continued to want to stay open so that they could serve the community and continue to test, because they knew that it was so valuable. And so that was really important to have that flexibility, but that, again, that constant communication and that co-learning and co-sharing of decision-making power was incredibly important. And then let's go to the next slide and talk about, one side of that coin and the structure. Liz, I'll hand it off to you.
All right. So we thought it would be helpful to break down how we set up this structure. So we had support from Dr. Casterier, the public health officer, to build a collaborative. In green, you can see the 13 community testing sites and Bobby's role, who was the community testing co-lead. We also had a number of folks from the county who were regularly a part of the program. And so those folks are in gray. Mike Way, the health equity lead, Stacy Kennedy, who is the community liaison, Carlos Cosio, who is emergency response. And then we were contracted with InSync, which is a staffing company where we contracted nurses and medical assistants. I think many of those people are on this call, which is great. So I'm sure they can add valuable insight to kind of how things were set up and what worked and didn't work with the key components. And then, as folks mentioned in their reflections, we had a number of lab partners. That's in orange there, UCD, STEM Express, and the state, as well as the public health lab whenever we partnered with the National Guard. And then the Sierra Health Foundation, which you can see there in the middle, as they acted as an intermediary and a fiscal sponsor for organizations that were looking to partner with the county during the testing effort. Any feedback on this or thoughts on this from folks that were a part of the structure?
I'll just say really quick, I really love seeing this like this. I actually just realized that it would have been maybe even more helpful with just how disorienting everything, was when we were just starting and moving, to see this flow chart at the beginning. And I don't know if someone else did see that. I missed it. But yeah, some of these would be very helpful, like at the go, as like how we're building it maybe.
Salma. No, we didn't have it. So that's great feedback. Armando, were you going to say something?
Yeah, I just wanted to let you know how much I appreciated how everything was handled. First time for a lot of us going through some of these things, and now transitioning over to the state, seeing how it was handled through the county. I appreciated the information, the meetings, the time you guys took to really keep us informed. So I think that was a big part of it, that there was that communication between you, Liz, and everybody else down into those bottom tiers, those last 3 rows. It was really important. And again, I appreciated that part of it.
Hi, this is Corrine with InSync. And I also want to piggyback on that. The communication was awesome between Bobby and Liz, and it's always a joy for us as a healthcare staffing agency to be able to pick up the phone and call somebody if there's an issue, or just the communication. I know that this was all new to everybody, and on behalf of InSync, we love the partnership.
Corrine, glad to see you're here.
Yeah. I think I just want to add from when I initially came on board, I wasn't the co-lead. I was really a site assistant at the TEDA sites, and you'll see them at the on the bottom 3 rows. And for us, like how we were quote unquote selected, it was selected by the community. My understanding is that because there were a rise in cases in the Asian Pacific Islander community, some of our community leaders were looking for a site to locate. They discovered the TEDA Pediatric Health site, and Dr. TEDA was open and willing to do that. And so I would say that that's probably a similar experience for all of the other sites, that these were organizations that were approached by community for the need. And so that's how they ended up being selected to partner with the county and be fiscally sponsored by Sierra Health Foundation.
Bobby, and folks might have additional thoughts as they take a look at this, which is we took the gray bubbles at the bottom, which were the 13 sites, and then with help from Bobby and putting our heads together, built out a bit of an organizational structure for the site. So each site had a site lead who was accountable to Bobby and myself on making decisions for the site and staying in regular communication, whether it was through the weekly meeting, or if they weren't able to make the weekly meeting because maybe it was on a testing day, through some other means. They managed their site staff, who were paid for through the community-based organization themselves. The site lead was also in partnership with an InSync RN, who also at peak times managed between 5 to 10 medical assistants at each site. And then when we hit our big peak, there was also the Sacramento Medical Reserve Corps volunteers, who between 5 to 10 volunteers at each site, depending on the site, depending on the time. So this could add up to upwards of 30 to 40 staff at a site during the peak times. And then at non-peak times, it could be much smaller, maybe 3 to 5 staff at the site. In addition, the Sierra Health Foundation had a resource coordination program, so that way individuals who tested positive at the site could be immediately plugged into the resources that were available to them. And not all sites were able to have a resource coordinator, but many were, and that was a super helpful wraparound service. The InSync staff reported up to me, but they were accountable to the site leads at their locations. And so we had a really interesting relationship and had to have super strong communication at every single site to make sure that it all worked out. And not saying that it was always smooth sailing, but we did have really regular connections for feedback and opportunities for improvement, which I think is everything. Any sites want to provide feedback? If there's parts of this that don't ring true on the structure or things that you want to add?
Liz, I think I just want to say that many of the Sacramento Medical Reserve Corps volunteers, they were actually not only, in a lot of cases, it was not really in addition to the site staff and the in-sync staff, because this was a time that the site staff and the in-sync staff were catching COVID themselves, and then they were not able to come in. And so they really were to try to replace, staff that were temporarily out due to sickness and illness. And so that was a real challenge to keep up. And so that Sacramento Medical Reserve Corps was really essential to keep us going. So, while on paper it might have looked that they had 30 or 40 people, really they were still operating the testing site with the limited number that they had.
Thank you. We were happy to help.
We're happy to have you, Lynn. Thank you so much.
Okay. All right, so we're going to go ahead and move to the next part of the presentation, which is key components, which is sort of what Alma had referred to. So some key components that our community testing sites and county partners lifted up are county accountability, and that just means like strong county partnerships in the effort. Fiscal sponsor, which in this partnership with Sierra Health Foundation, having the state lab that came available, and we'll talk about why that is, having weekly meetings with the program, and then having the program be community-led. So to talk, ground us a little bit in some of these key components, I want to invite Mao to talk to us about her experience.
Good afternoon, everyone. Mao Vang with La Familia here. I just want to share a little bit about the work that we've done and also a story. We have many stories, but I'll share one that in particular that stood out. So like many of some of you guys that are here, we've been testing since 2020. And so I find it very surprising that people still come in, even like I think even last week, that folks, like are still like, hey, like, what is the fee? How much does it charge? And that they still are not quite aware that these are all free to them. So a particular story that I want to share about our work is, I can't remember when it was because it's been 2 years. God, it's been a while. But I remember a mom of who brought in her 4 kids, and they were exposed. I think 1 or 2 of them were having symptoms, and she was in dire need of getting tested. And it was just very fortunate that, we test Monday and she was in South Sac. She didn't have to go all the way up north. And so I believe at that time, I think it was us and Liberty Towers up north. And so she came here and she was really, just thankful that we were able to register her. She didn't speak English, wasn't her strongest. She spoke Spanish. And so we helped her register her 4 kids. We got them tested. We explained the difference between a rapid test and a PCR, which many times, folks get confused between the two. And so mom was just really thankful to have, to have someone who will walk her through all of that, the registration, the process, what to look out for, to call us if they had any questions. So I just want to share how important it is, at the testing sites. At our testing sites, we speak English, Spanish, Hmong, Arabic, Farsi. There was a point in time we had a Farsi staff as well. And so it was just really critical to have this for the community. And I like I said earlier, I just can't stress people. Last week, I think I had someone who still asked me if it was free or not. I still have people who ask me, like, what are the other days? Or like they'll come on a different day to La Familia and we'll be like, oh no, we don't do testing. So for example, right now we have a partnership with Color where on Wednesday and Friday, they will do pickup for PCR tests. So we could do PCR tests The good thing about what happened recently is the at-home test kits, where if they do come on a day that's not us, that our testing day, and they're in a situation where they can use the at-home test kit, then we would provide them one as well. So just want to share some of those stories and just share how important it is to have the testing. Even now with the little spike that's happening now, folks are still very thankful to come in. I will say, I think today we have testing. That's why I'm not in my normal space for today. And I want to say, I think it's since December, we've never been this busy. So we literally had people constantly from 9 till 12 today, which I have not seen since December. So it's not a huge line, but it's been a constant.
Now. All right. So the next area we want to talk about is the county partnership with the program. So one of the things that our community testing sites lifted up was the importance of having the county so connected to the partnership. The county managed the budgets for the community testing program with Sierra Health Foundation, contracts with media, contracts with the state testing task force. The county had significant efforts within communications and media, which we'll talk about in a couple slides. They had a staff person dedicated to the area and numerous support staff from EPI, comms, equity, and more. And as a county program, that means we got credit for having the resource in the community, but we also were accountable to feedback and criticism from the community. So the first area for county accountability that we'll talk about is the budget. So as you can see, the majority of the budget was for laboratory services. This type of service is super expensive. And earlier on in the pandemic, and we'll talk about this in a couple slides, we did not have a state resource for lab services. And the public health lab only had so much capacity to manage testing. There was the CBO staffing through Sierra Health Foundation. So those are many of the folks on this call. Then in-sync staffing, which were nurses and medical assistants to provide support to the site. And then the final area was county staff. So we have Stacey Kennedy and Mike Way and Carlos Cosio, many of whom are on this call. And so it wasn't an exact, but that is the last sliver for county staff associated with the effort. Another area that our community programs lifted up was the communications that the county committed to as a part of the effort. There was 211 partnership that Stacey Kennedy managed and made sure that when folks called 211, they could be directed to county testing sites and supported in that. There was the county hotline that Chantal managed through volunteers, where if folks called into public health or emailed into public health, they were able to get directed to testing. There was school newsletters that we were partnered with, county flyers and Sierra Health Foundation flyers that were developed. There was a web page that was very popular. And Brenda, I'm not sure if she's on, but was super great about making changes at all hours because things were constantly changing. We had the regular media briefing that was led by Dr. Cassirier and our public information officers, and numerous news articles that highlighted community testing. And then we had a monthly Zoom forum. Before it was biweekly and then moved to monthly, where while COVID testing was not the center of that effort, was frequently asked questions during the forum, and it was a good way to share information with the community. And here we have just some of those highlights. We have a web page, some of those flyers, one of the great volunteers with the hotline, and then Dr. K and an article that was highlighted. Is there anything else that folks want to lift up as it relates to communications?
Hi, this is Isabel with Resources for Independent Living. My comment here has to do with the media access for people with disabilities. The website for locating testing sites was not 100% accurate in the way that it gave results. And also I'd like transportation to the sites, testing sites and other COVID vaccination sites was not strongly reinforced, and a lot of our consumers couldn't get to where they needed to go. We were there, thanks to Sierra and you guys to provide that bridge and gapping those services. But that was a very big component of the barriers that we encountered, and I wanted that mentioned.
Thanks, Isabel. Appreciate you lifting that up.
That's a great point.
Anybody else have any thoughts?
I just want to comment that, and we'll talk about our weekly meetings a little bit as well, but in our weekly meetings, kind of a lot of the asks for the communication was coming out from the test sites, like what was needed to help the test sites be more effective. And so that community map, for example, was like key to keep updated, because it was really nice for one site to have a community member come in, and if that community member asked, well, can I come back tomorrow? And we had to say, no, we're only open once a week, but you can go to these other sites during the rest of the week. It was really helpful. And then doing it, and there was a lot of signage in multiple languages that for the communities that we were serving. So that was useful as well. And so a lot of the communications was, I would say that when we asked for it, the county was very responsive to that request, and we appreciate that.
Alma?
Yeah, no, I definitely see I see your point, Bobby. I would like to add that one of the things that I noticed was that when they're at the beginning, at least, or at least like through the time that I was leading the site that went on then to be led by Megan at Liberty Towers, we did notice a lag on updating some of the things that were done by the Sierra Health Community Foundation. Sierra Health Foundation, and that was unfortunately maybe something that was improved on later on by having like one coordinated, centralized effort on things that had to do with all sites. But that was a constant struggle, and definitely like didn't make things easier in terms of how we all were already going through so many changes and updates, but also having conflicting information on the map. So like, web pages weren't updated quickly enough and things like that. So it was a little bit difficult when the communications were not as, I think, centralized, at least like one point of like central. And I don't know where that would fall, within the county or like maybe within the structure that we had. It would have been to have like one communications person. But yeah, I know that we were all also different capacities, but just in terms of the experiences, I wanted to share that because I thought those were like easy tweaks that we could have, improved on.
Salma, appreciate your perspective. We'll go ahead and boogie on to the next slide, just to be mindful of time, and we'll keep on opening up spaces for folks to provide feedback, because I love that Alma and Isabel brought up things that could be improved, because there's always things that we could have done better, and this is not a space to say everything was perfect, because it wasn't. Okay, so another area that community program lifted up that was important was having a intermediary or a fiscal sponsor. So we just wanted to outline how that worked. There were state, federal, and county dollars, and the Sacramento County Public Health took in those dollars and created contracts. One of the large contracts was with the Sierra Health Foundation, who then subcontracted out to the 13 community-based organizations. And what they offered was a financial infrastructure. There was a number of different funding sources the county was working with. They have the capacity to take in federal and county audits and have the cash flow to be able to manage this amount of money coming in and out. They held significant amount of contracts for small community-based organizations that would have been hard for the county to do quickly. And then they had invoice and payment systems. As a partner in the program, they also led some communication efforts and resource coordination. We do have another part of the presentation where we talk about GLOws and GROws, and I know that this area is going to be lifted up in both the GLOws and the GROws. So to your point, Alma, there's definitely areas that worked and areas that we'll learn from. So just coming back to the laboratory piece, as you can see, the lab services were about 86% of the total budget. And because doing laboratory services is really expensive, and we wouldn't have been able to continue the program if the state had not opened up a state lab that they offered for free to counties and community-based organizations. So only because the state lab happened were we able to continue the program. So the community programs really wanted to lift that up. Again, no, there were some bumps throughout. They were in the media a number of times around different items. And if they weren't there, we wouldn't have the program. Okay, I'll pass it over to Bobby.
Thank you. So another key component was to the communication was we had weekly meetings with all the community test sites were invited. The county coordinator, Liz, was on each call, and then the public health liaison, usually Stacy, was on the call to help provide information and relay information as well from the community test sites. On occasion, we would ask representatives from Health Equity, the Sierra Health Foundation, and Epidemiology, Hi Ranjit, to come in and like provide key updates and indicators that we needed to make, better informed pivots and decisions on what we needed to do week to week. This allowed us to stay nimble because COVID-19 was from one week to the next just really different in how we were having to deal with it. And then, of course, the public response was also could be challenging. So these weekly meetings were just really key to staying in communication and providing each other updates and just being able to check in with one another. And they were about an hour a week, sometimes 90 minutes, depending on if we had a lot on the agenda. But the folks were able to carve out the time, despite everyone's busy schedule. It was just really important to do. So let's go to the next slide. I sort of mentioned that during these weekly meetings, right, the community and the community organizations would request for things and also was given autonomy to decide on their staffing and make the budget decisions where their site was going to be. I know our site had to move 2 to 3 times because our landlord got upset because of the volume of people that were coming in. Also the timeline, how long we were going to go. And like I said, some of the sites continue to operate through the state testing grant. We were managing and doing inventory of our supplies, scheduling. Some sites needed to open up really early to best serve their community. Some sites needed a half day, other sites needed a full day. There are a couple sites even, one site was even open on Saturdays in order to best serve the community. And then also the final decision on doing the local outreach. Most of us were targeted to serve a specific community. And so we knew the best way to serve that community because most of our organizations are already serving that community. Now we were just serving that community with respect to COVID-19. And so it was important to allow the community organizations to lead in these areas so that they could, do what's already trusted by the folks in the neighborhoods. So let's go on to the next slide. So within each community organization budget, again, an area that each organization had control of. Initially, we were given $2,072 for a 4-hour testing event. Like I mentioned, some sites did half-day events, other sites did full days event. So this sort of varied, but it was broken up by the $2,072 $72. And that was meant to take care of the salary and benefits, any operating costs like, facility rents, costs and insurance, supplies, also one-time costs. So initially we had to make sure that we have the initial marketing materials, translating flyers for the first time, and that we can just continue to reuse throughout the entire pandemic. Maybe purchase of some technology materials, because when we transitioned to the self-swab, it was suddenly very digital. And so we needed tablets and laptops to use with the scanners that we were provided by the county. And then also all the indirect costs, things that the additional calls that all of the sites would get in order to provide testing, because we were getting calls every day of the week about, when we were offering testing and what was needed and, how it was going to go through. Additionally, you'll see at the bottom, $2,500 per pop-up event. So many of our organizations would provide pop-ups throughout parts of the county. For example, we would go, I know the Robertson Community Center, they actually did a back to school pop-up, which was really useful and beneficial and very strategic, because all these students are coming back from summer vacation. And then I know that the county continued to, and all the local school districts continued, when folks were coming back from winter break, that all the students should get tested in order to help protect the community. And so these $2,500 pop events covered all of the stuff above, as well as the cost of having to travel and pack up, the additional time needed to get ready and break down in order to serve the community. So some organizations did these pop-ups, others didn't, but every single one provided at least a weekly events, excluding holidays when they were closed. And in a lot of cases, many of the sites operated on the holidays, because that would be a good time that the community would be free, and they didn't have other obligations that would compete with the need to get tested. So any questions about that? If not, I want to open it up. If we could go to the next slide, we have Armando from the city of Galt to talk about their experience with testing and how they designed their program to best serve their community.
Yeah, Bobby, thank you. Like you said, we know our community, and you allowed us the flexibility to change our hours to accommodate our residents, our groups that needed the testing the most. Looking back at those maps that you showed, where we were probably the only area in the Southern County to have testing, our group couldn't travel 20 minutes to Elk Grove or 20 minutes to Lodi to get these tests. So when schools were trying to reopen, our teachers needed to test before they went into classrooms. They were required to test. So what we did is we opened up an hour earlier, opened up at 7 a.m., allowed the teachers to come get tested and then report to their classrooms. So it allowed the schools to provide in-person teaching. So to that, I appreciate the fact that we were allowed to change our hours and serve the community needs.
Armando.
Great, thank you, Armando. Armando didn't share this, but I recall during one of the weekly meetings, he mentioned that there was not like a CVS or a Walgreens or a hospital providing testing in the region.
We don't have an urgent care in this town. We do have a few doctors, but very, very few. And at the time, CVS and Rite Aid, they were not carrying those type of tests. Things have changed since then. It's available at a few different places, but again, still we're open because it makes it easier for our community to get here on a Thursday morning before work starts.
Yeah, so just so important to fill that gap that the market was not filling, right? And so again, just such a vital resource for the community. So thank you, Armando. And thank you to the county and all of our partners that helped make that happen. You don't know exactly how many lives you've saved, but I think you've also you also helped folks avoid like the stress and pain of just of worried about getting sick from COVID-19. So another thing that sites were heavy on. So in addition to the county-led communication efforts, the sites also had autonomy to create their own flyers and outreach materials. And so you'll see these are some examples of some. There were lots of social media, a lot of organizations and groups and community members are getting their information through social media, which is both an opportunity, but also a challenge, right? Because there's so much misinformation on social media. But so that was a space that we operated in. Sites created YouTube videos. You'll see that that self-testing video was when we were going to pivot to self-swabbing. And so we wanted to show people how simple that was. And some of our testing staff, community site staff offered to do that. We translated flyers into different languages. So you'll see the Hmong flyer in the middle row to the right, and then a Spanish flyer in the middle column at the bottom from La Familia. And then, of course, when we were holding pop-ups, like in this case, it was at the Martin Luther King Jr. Technology Academy, right? Like a very bright yellow highlight that we were doing a pop-up, you know, and it was for one day. And also, of course, all of these are branded, you know, with partner logos as well to make sure that everybody knew that this was a community effort and a joint effort to serve. So that was important as well. So if we can go to the next slide, I'm sorry. Now we're going to cover our glows and grows on the agenda. So let's go to the next slide. Our glows will be kind of what worked. And the feedback from the community sites were the following 5 things. Dedicated staff, right? So being able to have staff that they could hire and employ. In some cases, the community organizations picked up new staff. In other cases, maybe they expanded hours for an existing staff member so that they could retain that information and keep the programs running. The strong communication that was occurring, that was definitely part of the ethos that we built a very strong culture that was inclusive of communicating like really the truth. Like we did not hold back when there were concerns and questions that needed to come up or that needed to be answered. The CBO network, these were trusted organizations in the community of varying sizes and varying like histories and time of operation. We had churches, we had nonprofits, we had you know, a medical practice that was, you know, in this case, serving at doing the nonprofit work. And so, and then the city of Galt was another partner, and then River Delta Unified. So a vast kind of network of trusted individuals and trusted CBOs in the community. The state resources were invaluable. We depended on the state to provide, as Liz said, the state testing lab, but the courier network to deliver and drop off, because the state testing lab is in Valencia, that courier network meant that we didn't have to figure out a way to get the, you know, maybe contract with FedEx or whatever to get the tests down to Valencia. The courier network was able to do that for us. And then that additional staffing during those peak times and when we were losing staff to COVID-19 was really integral through the SMRC and InSync. You know, because also when we had InSync staff that maybe they transitioned out of the program, you know, we InSync was very responsive to backfill them and make sure that we stayed as fully staffed as possible when we could account for it. Any questions about what worked? Okay. And so when we asked folks, you know, to enter things on a word cloud, it was clear that, you know, this service was incredibly needed and that we were filling a gap, right? That even though it was constantly updating the power partnership, all the bridging and the access that we were providing was effective and meaningful. And so these were all keys to making sure that this was a success, so that we could test 60,000 people in a week, you know, or in a month, 15,000 in a week, and, you know, 300,000 people overall. And again, to help avoid sickness and death, and reduce the amount of stress that was in our communities. So how did we do that? In the next slide, you'll see, and we talked a little bit about the PHI, the Healthy Places Index, but that and our goal was always to center equity. That's why we wanted to, when Mike came on board, we wanted to make sure that Mike, as an equity lead, was around, that we did partner with the disability, or we thank and appreciate the Disability Advisory Committee for educating us on what we needed to be more accessible, providing the training and development. Like, for example, we did a cultural, not a cultural humility training with all of the staff, both in sync and the CBO staff, funding the sites. Regarding this, there's a quote from Mayor Garcetti, and
Oh, you're muted, Bobby.
thank you. This quotation in the chat that I just put in the chat is from Mayor Garcetti, and he wrote, or he said, that government usually doesn't know what works well, and people who know what works well can never scale it up for everybody. So activists need government, and government needs activists and innovators. And so that's what this was, right? Like, being able to fund these sites, if the sites were considered the innovators and the activists, then, you know, the government was able to help fund that. And the government has the power to scale things up, but maybe not necessarily the resources to do the individualization that's needed to serve individual communities. So the fact that these sites were neighborhood based and they were fully staffed allowed us to translate, allowed us to do the things that we needed to communicate with our community. I know at our site, we had several deaf community members come through, and people with different developmental disabilities. And fortunately, Dr. Teta is very well trained in working with folks that are that have autism and are on, and so, like, she also worked with us in order to provide that resource. And then, of course, the data and the epidemiology, we often asked for disaggregated data, and you know, some things are beyond our control, but it was very important that we voiced our need and our concern for that. And where we did get data, it was useful, and so we tried to use that in the best manner that we could. So we can go on to the next.
And I know that we have Mike here and Ranjit, so I just want to open up if there's anything else that folks who are listed in these bubbles and did this work want to add in.
Yeah.
Hi everyone. I have nothing major to add. I tried my best to come to the weekly meetings as often as possible, but couldn't always be there. I hope the data I provided were helpful and helped guide the efforts that all the community sites were undertaking. It was certainly fun to work on. It was a lot of work, but it's also rewarding in its own right. So thank you to everyone.
Thank you. Okay. All right. Thanks, Mike. Thank you as well. So now let's talk about our grows. So while the Sierra Health Foundation being a fiscal sponsor was useful, we did run into some problems with respect to contracts and invoicing. I will make note that it was, you know, in the beginning, it was pretty easy, but like, as this continued on and the different sources of funding federally were being added on, that's where it became sort of challenging. And so, you know, that just became part of the reality. Community access, like as was previously stated, you know, there were some things that we didn't quite get there to make it fully accessible to folks. There was always continued requests for extended hours, later hours, more weekend sites was one of the feedback pieces. And so, you know, maybe also our sites, while they were located throughout the community, each of the 13 sites was open one time a week. So one day a week, or one morning a week, or one afternoon a week. And we had to direct people to other sites, which might have been across the county, in order to get tested the following day. And so, that's just another thing to think about, that, how do we build more distribution into a program such as this when we're trying to serve so many people? Grows with staffing. It was unexpected that we would need the Sacramento Medical Reserve Corps. So this is not a slight on them. It was just the need to grow and retract very quickly in light of the demand, was challenging to keep it going. And the contracts and the invoicing led to some challenges as well, because community-based sites were trying to pay that staff. And if we couldn't tell that staff person, oh, the program's going to continue through this date, oh, we're going to definitely have funding for it, or things like that, it made staff, it forced staff to choose, to sometimes leave, because you can't pay bills with an IOU. And then the last grow was the constant change. As we highlighted, we changed lab services several times. There were extensions to the program that were unknown or unexpected because of the nature of COVID-19, the seasonality of it, but also the degree of the I'll call it the rebound of volume during the summer and winter, that we didn't always anticipate, were among some of the grows. So being ready for those type of things would be really helpful, and would help other folks prepare. So finally, we asked in the feedback session, would you participate as a partner in the future with Sacramento County? And everybody agreed, 14 more strongly, strong yes, and then one with a maybe, and justifiably it was, it's just sometimes about some of those things that we want to improve upon to make that experience better for everyone. And Liz, did you have anything to add on that slide?
Just that this is a big win, right? Like for the county, that community-based organizations are interested and willing to partner with us again, because we know that there's going to be more needs for us to work in partnership with community. All right, so I know we're just about at time, and I want to leave some time at the end for additional comments from folks. Essentially, this is basically our last slide, is a summary of key considerations for whomever might be interested in doing a partnership like this in the future. So partnerships with trusted community-based organizations is key, as noted in the last slide. It's great that people are willing to work with us in the future. Grassroots organizations may need infrastructure support, such as an intermediary, to successfully partner with the county. Community-based organizations need funding to allow leaders to staff up and manage the work. Volunteering will only go so far. Dedicated county staff to manage coordination of efforts allowed for a strong program, communication, and collaboration. And finally, county supports in other areas such as communications, SMRC, and sync, the state contract, were vital to the program being successful. So what we want to do now, and I'll just leave this slide up, is, there are folks here who either manage testing sites or manage contracts, data, hotline volunteers. Are there other key considerations or things that you're thinking about as you experience the slice of the community testing program in your world, or just reflections from the presentation? So you can either come off mute, and no pressure either way. And we also have a mentee. So if you want to just take a second and reflect, we'll also have that, where you can let us know what you're thinking about.
I have a comment, Liz.
Mm-hmm.
And this is one of those complaints that I have that I know there is no answer to, but I just want to bring up to the group as a whole. I had an issue with the media during this process, and where they were more wanting to tell their story than the facts. They wanted to get out that what I guess this testing program was doing wrong in their eyes versus what we were doing right. And I don't know how to fix that, but if we can't have a true and reliable partnership with the media to tell the truth, good or bad, I think that's a difficult thing to do. You know, I'm sure you remember the incident in which we had. So I don't know that there is an answer to it, but it was a frustration of mine.
Yeah, thanks for lifting that up, Armando. It was a challenge in different pieces. There were good things that the media partnered with us on, and then there were many challenges throughout too. Anything else that folks are thinking about? I see overall review of the numbers, people served, and the cost, which is great. Can we continue sharing leadership in this way in things like elections and other services to the community? That's awesome. I love, you know, Bobby and I were talking about how we wanted to do this presentation, and we wanted to make sure it was like really CBO plus county, because modeling kind of what the partnership looked like and how we would recommend it moving forward. How we maintain community supports if funding dwindles. That's a great point. A lot of funding was flowing with COVID-19, and that's not always the case when things come up. Learn more about best practices for community engagement. Fight disinformation. Okay. Leave it open for a few more, just in case anybody else has anything they want to share about any piece of the presentation or things that we should think about moving forward. Because again, Bobby and I created this based on our feedback session with community testing sites, but there's likely stuff that we're missing.
I know that a lot of the folks have moved to the state partnership, right, with testing. But what is the continuous county role in ensuring that as we hopefully transition, right, to an endemic, that there's still that local support that the state might not be able to provide. And so some of it, I think folks have mentioned media or like communications. Do you all have any points on that?
Mm-hmm. Yeah, so it's a great point. The county's role has shifted. So this was about the period of time where the county was managing those contracts and providing additional support. And now with it being a state contract, I actually have one of my colleagues here, who is going to be managing the county's end of the work in August. So Fu, I don't know if you want to say hello.
Hello, everybody. To answer your question, I'm just starting this position on helping with the testing sites. And so right now, as you all, the individuals who are still having the testing sites, we are providing the nursing support. And so I'll be helping managing the nursing as well as advocate for the sites that are still open as much as I can. If there are some issues, I'll try to help you communicate with the state more. And I'm learning this position a little bit more, and definitely I would like to definitely help and support, and I'll start doing site visits just to kind of check on the sites to just see what I can do to help. So I'm learning everything, and this has been a great segue to help me help you all with the future of the testing sites. So please bear with me. I'm learning a lot, and I have a lot of big shoes to fill from Liz. So please be patient, but I'm definitely here to hear what you all have to say and to help out however I can.
So thankfully I have a really small shoe size, so you're good to go. But Alma, appreciate lifting that up, and you know it'll be an ongoing changing in terms of kind of what things look like and the effort as resources change, as priorities shift, but appreciate you lifting that up. Bobby, was there something you wanted to add in, or?
Yeah, I know that like early on and as we like went through it, I always felt like, you know, our the care providers should really be doing the testing and the treatment of COVID-19. And ultimately, like I would feel that that would be the ultimate goal. However, what I also learned in this process is that there are a number of people that are severely disenfranchised from even that, right? Like even receiving, you know, for whatever reason, they don't get care, right? They don't get health care. And so I think that that's where public health, you know, in particular, is like a key player in that. Like, so how does the system continue to make sure that there are fewer and fewer disenfranchised folks to not just get care for COVID-19, but for like the benefit of health and public health overall.
Thanks, Bobby. And I think Alma +1 your point in the chat around, you know, who is or isn't able to access that. Great.
I'm just gonna say something really quick and have to hop off, but I wanted to share really uplift that we know there was a mass exodus of public health workers during the pandemic because of you know, all these different challenges that we're like talking about. Definitely like just really want to uplift the work that you all have been, that you all are staying here, that you all have continued to be, because that continuous presence has been really significant to be able to move forward among all this chaos. So really, yeah, just big shout out to all of you in public health and being part of these like pieces.
Thanks, Alma. And we have quite a few public health folks here. Chantal, Mike, Ranjit, Boo. So appreciate y'all. I'm sure there's more as I scroll through. Stacy. So yeah, thank you so much, y'all. Bobby and I will stay on if there's folks that want to say hello or have other things that they want to share. So we'll be here, but we'll go ahead and conclude. And I will follow up with the presentation. So that way, if folks want to dig into that a little further, they'll have the opportunity to do so. But thanks for coming and sharing your wisdom and insight and feedback.
Hey, Liz, one thing I'd like to just share, going through this process, when I wasn't asked to do this, I was told to do this. So I think a lot of us were told to do these things. And if I'd really had thought about it, and this has opened my eyes to any future events that have to come along, is that I would open something up on the weekends or after hours. I think that was the biggest issue. I think that was the biggest issue for us. If I had really looked into this, really had been on top of it from the beginning, the choice of my days and operational hours would have been really different. And if something does happen like this, that I think might be a challenge in the future, I would recommend after hours and weekends. I know that's not what we typically do in government, but I think it would serve the most if we were able to think that in that capacity, not a Monday through Friday, 8 to 5.
Thanks, Armando.
Liz, I just put so first of all, good job. This is amazing work. Thank you for sharing. And I just wanted to put a little plug. If you're doing work like this again, moving forward, I noticed you worked with a lot of the providers that do outreach for cultural competence, and there are more. So if you ever wanted to expand that, I'd be happy to link you. because you're working with
Thanks,
about half the folks we work with. Okay, thank you. See ya.
Bye. Okay, anybody else have any other thoughts? Or maybe you had your phone on and went and grabbed lunch. You don't know that we're still talking, which is totally fine too. Okay. Bobby, you're joining again.
Sorry about that. That was my phone.